a 5-year grant cycle, so I can come back here again. But that helps to prove that I'm doing my job and that I'm reaching people and that I'm not just making up Joe Schmo and going to a program and not talking to anyone. But for those of you who know me, I could talk about this all day long, so I would never do that anyway. But let's see, how do I want to start this? How many of you remember the last time I was here? Good? Okay, good. Yeah, that's okay. You don't have to remember my name or my face. Just know that we talked about this. So we've talked about a lot the basics of Alzheimer's disease and kind of how they, show up, the science, the research, which is all good stuff. But now I kind of want to pivot just a little bit and talk to you all about the signs and the very early symptoms of Alzheimer's disease or dementia. Does that sound okay? Mm-hmm. Okay, good, because that's what I'm doing. So, sorry. I'm in a cheeky mood today, guys. So you're going to have to put up with a few jokes, but it's okay. So the idea of the program today is really just to understand what is typical age-related memory, thinking, behavioral changes, and what's not. Every single time that I do this program, I get at least 2 to 5 people coming up to me and they're like, Claire, I have one of those things. And I said, that's okay, I have 4. So you're fine, I promise you. If you've always been bad at math and you're bad at math and you're 75, it's fine, right? So really, I think we'll walk away feeling a lot better and you'll understand what is cause for concern if you have any concern at all. Easy peasy. So then we're going to talk about how to talk to people about this. It's not as easy as walking up and saying, Jill, you forgot to wear your pants today. That's not going to work. It doesn't work like that because it doesn't show like that right away, but we usually don't talk about it until it gets to that point. So it's talking and saying, hey, we've had this standing lunch appointment and for the last couple of weeks you've shown up on the wrong day or at the wrong time, and I just want to make sure that everything is okay. I've been noticing this, but maybe you're stressed, maybe we're tired, maybe you have a vitamin deficiency. I don't know, but I want to rule everything out to be able to help you. So all of those things, and then we'll talk about the diagnostic process, which has changed a lot in, we'll even say, the last 10 years. So for those of you who know, I keep things pretty casual. So if you have questions, please just shout it out. I do not mind if you interrupt me. If we have to repeat something, let's go back. Sound good? Mm-hmm. Okay, good. And everyone can hear me, right? Okay, good. I really need this thing. So for all intents and purposes, along the whole program today, we're going to follow a family called the Garcias. This is kind of easy because it kind of personifies how we're going to go through things, right? It's not just talking about patient X, it's talking about Mary, who is somebody in the family. This program also takes forever to load, so thank you for your patience. So for those of us who can't see, Mary is going to be our patient today. She is a 73-year-old widow who lives alone. She's a retired teacher who has always meticulously kept her house very clean. Her daughter Lydia has been noticing laundry pile-up, junk mail, and some old newspapers lying around the house, which is very out of character for Mary, so she's a little bit concerned. I would be concerned. So Lydia says she's worried about Mom. She keeps losing things, and the house is a mess. And her sister responds, it's probably normal to get a little forgetful with age. Not true. She says it's so unlike her. Should we worry? And then she says, why don't we reach out to our family friend who's a doctor?
As we get older, cognitive problems become more noticeable for almost everybody. And it can vary from person to person. Typically with age, people have trouble coming up with the word they want right when they want it. They have trouble remembering names and they don't think quite as quickly. What's more concerning, or what might be the beginning of a memory problem, is people have a lot of trouble coming up with words or names, and it's happening more frequently, and the words or names don't necessarily come to them later. And then they start misplacing things, but not just once in a while, because we all misplace things, but more often. And it begins to interfere day to day. That should be a warning sign for people that this might be the beginning of a memory problem.
So the key word that he said, we've all forgotten names, we've all misplaced things. It's going to be interferes with day to day, right? If I lose my car keys, I can usually find them. They're more often than not in a very weird place. I've put them in my freezer. You know, they're in weird spots, but I can usually retrace my steps and find what I've lost. If I walk back into the room after 15 minutes of forgetting why I walked in there, which we all do, I can usually pick it back up. I can retrace my train of thought. I can do all these things. You're busy, you're stressed, you've got things going on in your lives. It would be strange if you were functioning at 100% all the time. We're going to have memory loss. We're going to forget things that maybe aren't so significant. Perfectly fine. But it's when it starts to interfere with that day-to-day functioning. The best example I can give you is, if I hand you, Jill, my car keys, you could probably click the button, find my car, and start my car. Great. But if I handed you my car keys and you said, what are these? What do I do with them? That's interference with day to day, right? I drive every single day. You drive here every single day. So it's something like that where I would be concerned. It's not so much, where the heck did I put my keys? I lose the thing that has this program on it every time, and I say, oh my gosh, did I forget it? No, it's just in the bottom of my bag. Takes me a minute to find it, but I panic a little bit every single time. But it's always there. So if you notice someone is looking at their fork funny, and maybe we don't remember exactly how to use it or what's it for, that's where I'd be concerned. Not so much as that they're not eating and that maybe they're in a bit of a mood. Does that make sense? Okay, good. So we're gonna jump into the 10 warning signs of Alzheimer's. And when I'm talking to people, they say, okay, well, what's the difference between Alzheimer's and dementia? First thing first. Can anyone tell me? I can tell you. Okay, fine. Twist my arm, guys. So think of dementia as our umbrella term. It's our bucket for all the symptoms of what a specific type of dementia causes. So Alzheimer's is our specific type. Lewy body dementia is a specific type. They're caused by two different things, but they cause different symptoms. So when I go to the doctor, the first thing they're probably going to say is, okay, you're having memory impairment. I'm going to diagnose you with dementia unspecified. And that's where I say, okay, but what type is it? And they'll say, well, I can't see into your brain, Claire. We're going to send you to a neurologist. They're going to do an MRI. Then I can figure out exactly what that cause is. So to simplify it, if I ask you to go to the store and get me some bread, you're going to get to Walmart and you're going to say, okay, I'm at the bread aisle, and it's a whole wall of bread, right? There's a ton. There's lots of choices. There's lots of types. It's all made differently. Dementia is our bread. Alzheimer's is our white bread. It's our most common, easy to find. Typically, we know it's made differently than wheat bread. Different ingredients, different processing. So our bread is dementia. Our types are the specific causes. Does that make sense? Yes? Okay, cool. Good job, everybody. Sometimes I have to go back for that. It's perfectly fine. So if you have questions, just let me know.
So an MRI tells you which type?
Exactly, yes. So what you would see if I came to my doctor and I said, you know, I'm concerned about my memory, they would have me take that little mini mental test where it says, okay, what's your name? What's the date? You know, who's the president? What's the season? And then I need you all to remember pencil, apple, table. Okay, so now we all need to count backwards from 100 by 7. Okay, so 100, 93, 86, 79, 72, and so on and so forth. So you got to get down there. Then I need you all to draw me a clock, you know, blah, blah, blah. What were those 3 words again?
Apple, pencil, table.
Thank you. Absolutely. So you take that test. That'll give you a score. To be completely honest with you all, I'm very bad at math, so I usually get about a 28 out of 30. No big deal if you don't get a perfect score. It's fine. But what that does is establish my baseline. So that says, oh, okay, Claire usually is at a 28, and now she's dipped to a 25. That's my trigger for an MRI. What's going on in her brain? So then they will do the MRI or a PET scan. Most likely going to be an MRI because they're less expensive. But then it'll show plaques and tangles in my brain that are indicative of Alzheimer's, or a certain protein deposit that's indicative of Lewy body dementia. It might show an area of the brain that didn't have appropriate blood flow to it, and that part is damaged now. So there's all different types, but the only surefire way to know is going to be imaging.
How many types are there?
Hundreds, yes. I can go over the most common if you'd like. So we have Alzheimer's, which is caused by a cloud of amyloid plaque and tau tangles. That's what we most think of when we think of dementia. Alzheimer's was discovered about 118 years ago now. But the only surefire way to diagnose it was after that person passed, then I could look into your brain until about 40 years ago when we started really seeing common brain imaging. There's Lewy body dementia, which is hallmarked by a protein deposit in the brain called alpha-synuclein protein. These almost look like little vegetable peas on an MRI in the brain. This one's very interesting because it can be very behavioral in nature. That person can have a lot of symptoms associated with depression and anxiety. There is vascular dementia, which is caused by a lack of blood flow to a certain part of the brain, most likely because of a stroke. This is a lot more sudden because strokes don't take a very long time, right? They usually happen very quickly. Ooh, I'm awake. There is, let's see. There's Parkinsonian dementia, which is usually caused by Parkinson's as it progresses. There's Creutzfeldt-Jakob's disease, which is caused, does anyone remember Mayor Jimmy Griffin from Buffalo? A lot of people thought Mayor Jimmy Griffin was just drunk. Turns out he had Creutzfeldt-Jakob disease, which is like dementia on steroids. It's a very quick progression. It's caused by a misfolded protein in the brain. People equate it to mad cow disease, but it's not the same thing. It just happens in that same general way. Yes?
I'm having trouble hearing you.
Okay, I'm sorry. I'm very bad at microphones. Yes. So then there's also Wernicke-Korsakoff syndrome, which is something that's come up in the last 20 years that we're really starting to understand. And this is caused by a lack of thiamine in the brain. That's caused by years and years and years, like 40 years, of really heavily relying on alcohol. So the more we drink, the less thiamine is in our brain. This is the only form of dementia that is slightly reversible. So if we catch it soon enough, I can give somebody thiamine, which helps to replete the brain a little bit, but it's, and I hate that you're videoing this because this is a crude way of putting it, but I can turn a grape into a raisin, right? I cannot turn a raisin back into a grape. So if we have thiamine and then we lose it, and I can give it back, but I can't give it back fully, we're not going to get all of that cognitive functioning back. Does that make sense? Okay, cool. So those are a lot of our most common types. We're seeing also traumatic brain injury-induced dementia. We're seeing this a lot in our football players in their 50s. So I talk a lot with the NFL alumni, particularly the Bills, which is always fun. I'm still waiting to meet Josh Allen, but it's okay. I'll get there someday, everybody. But the point is, we're seeing a lot of these head injuries really truly have long-term impact in our 50s. So the more you can do to protect your head, that's the only thing I can tell you is 100% going to keep your brain safe. Oh, good question on the types. Any other questions, you guys? We're good? Okay, great. Why is it important to know the signs? Good question, Claire. It's important to know the signs because the longer that we don't address this, the longer that we kind of let things go and we're like, oh, it's just Jill, she's a little quirky, she's fine. That's time that I could have used planning with Jill, asking Jill about what she wants with future care, what we could have done differently. I could have been a better friend had I known that this is what she's dealing with. You know, the list goes on and on and on, but it's important to know the signs because it's important to treat people appropriately, right? It's important to know what we're dealing with. It's important to know, even from a care planning and medical standpoint, what I'm up against. So we're gonna go ahead. One of the things that I always get is people see this checkerboard of all these different signs and symptoms and they say, well, I have 1 and 2. Do I have to have the rest? You don't have to have all 10 or notice all 10, but if you have like 1, it's okay. If you have 2, it's probably okay. There's a lot of things going on. Your diet is tied into things, hormones, sleep, stress, all of these things are part of our normal day-to-day. So relax a little bit. It's the best advice I can give you. But number 1 is going to be memory loss that disrupts daily life. That's the car keys, right? That's maybe not remembering, we've met enough, Jill, that if I don't remember your name, that's probably going to be a little weird, right? That would be a cause for concern for me. It could be leaving here, getting down to wherever you're going, and not remembering how to get back. That's a concern for me. That's memory loss that disrupts daily life. But this is very broad, very person-centered. Number 2 is going to be challenges in planning or problem solving. You're like, wow, that is really broad. So let's kind of open that up a bit. So people might be experiencing changes in their ability to develop and follow a plan, maybe work with numbers. This can be tough with bills. This can be really tough with, even just a tip at a restaurant. That's really tough for a lot of people. And it can take a lot longer for them to complete tasks. So we might not see the task not be done, but the task might not be done up to par, or it might take, when it takes me 15 minutes to enter a clinical note in my computer. After I was sick for a while, it took me about 45 minutes. My brain was just not working how I wanted it to. So even that, kind of like a brain fog, can be part of it. Does that make sense? Okay. Difficulty completing familiar tasks. I see this a lot in routine. So for me, I wake up in the morning, I get ready, I take my dog for a walk, I make my cup of coffee, I do the news, all this fun stuff. And that's pretty much my routine every single day. I'm outside by 7 a.m. walking around the block. Maybe my routine is disrupted. Maybe I end up being late to work. Maybe I'm, showing up and my hair is all messy, which it is because my windows were down, but it's fine. So difficulty completing familiar tasks can be a big one. You might notice this in a person's appearance more than anything. Sometimes hygiene is one of those first things that we maybe miss a step. For our gentlemen, maybe it's that we haven't shaved our faces in a couple days. You might have more of a beard than normal, and they've never had a beard before. So it's even something like that that we might notice. Number 4 would be confusion with time or place. So again, that's getting down the hill and maybe going to the gas station and saying, what was I supposed to do again? Because after that, you were supposed to go to the doctor's, but you forgot that it's Wednesday, and I forgot where I was going to go there. And then we're all turned around, right? It can be as easy as that. You guys have questions so far? We're good? Okay. So number 5 is going to be trouble understanding visual images and spatial relationships. You're like, what is that? It's actually pretty easy to pick out once you know what you're looking for. If someone with dementia is just walking down the street, they might weave a little bit more, or maybe their gait is a little bit less steady because they're having trouble perceiving what's in front of them. Maybe that depth, maybe the coordination is a little bit off. Maybe it's that something looks deeper than it is. Maybe there's a dark rug in front of me and I think that that's a hole or a divot in the floor. So instead of walking over it, I'm gonna walk around it. It makes sense when you think about it, but when you're looking at people and you're like, oh, that's fine. It's actually pretty easy to pick out. The other one is, it's pretty easy to see this on someone's car. I just bought a new car. I'm really excited about it. No dents, no dings. Great. It's gonna get some, and that's okay. I'm not great at parking, but someone with dementia might have a couple more scrapes on their car than they would normally. If you're a great driver and you're fine, whatever, great. But if we're looking at their car and we're saying, did you mean to hit that shopping cart that I saw that you maybe didn't see? Part of it. So that's kind of a hindsight one. Another one is when we have dementia. You guys all have peripheral vision, right? You can see over here and you can see over here. Someone with dementia might not be able to see that. So when you're coming to talk to them, you might notice that you startle someone a lot more if you come from the sides. So always talking one-on-one can be very helpful. You guys are looking at me like, are you sure? Is that real? I promise you it's real. So new problems with words in speaking or writing. The best example I can give you is I have birthday cards from my grandma. She's a sweet lady and she lived with Alzheimer's for a really long time. And for the first 2 years, she spelled my name correctly, C-L-A-I-R-E. And then after a couple years, it was C-L-A-I-R. And then she missed the R, and it was just Clay. It was there were a bunch of variations of Claire. And then eventually, it was kind of just a scribble. We were okay with that. It's nice to, have those and get to hang out with her still in that way. But to be able to see the progression even in what she spelled for all my life is a big one. So if we're looking at misspelled words, words that we use quite often, if I'm talking about sociological jurisprudence, can you guys spell that? No, but it's words that we use often. So something like that. Names that we often use. If I write a letter to my sister every month, I'm going to spell her name correctly. So something like that. Number 7 we've gone over is misplacing things and then losing that ability to retrace. So that makes sense. Number 8 is going to be decreased or poor judgment. And you're like, what? Is that part of it? Yes, it's part of it. So when we think about our brain and the way that our brain connects, you're not just thoughts, right? You're also logic, you're also reasoning, you're problem solving, you're doing all of these things. You're judging, that person looks like they're going about 55. I should not pull out in front of them going 35, right? Seems like it makes sense to me. But that is decreased or poor judgment. It's when I'm driving, merging onto the highway and not going the speed of traffic. It's not looking. It's maybe buying something that's out of my budget that I don't need because it's new, or something that I want but I don't necessarily need. It can be all types of things, but it's really that poor judgment. Maybe the poor judgment is even in social situations. Maybe it's calling people out on something that they can't change. I'll be so honest with you, one time I was about 16 and my grandma and I were in a grocery store, and the woman in front of us, my grandma did not like her appearance, and she turned to me and she said, that woman is so fat. Except she had another word in the middle, and it was very crude, and I'm not going to say that on video. And I turned beet red, about the color of that couch, and thankfully the woman was able to kind of piece it together. She was like, oh, okay, this woman has dementia. But it's even what comes out of our mouths, right? Maybe that filter is dropped a little bit. So you kind of have to think, is that something that that person would normally say? Is that something that the social situation warrants? And that can be a tough one. This is very broad. We kind of have to boil it down to be very person-centered. Number 9 is actually a huge sign. This is one of my biggest signs for people. More than 2 to 8 for me. This is going to be withdrawal from work or social activity. So I know something's wrong cognitively with me. I don't want you to pick up on it, but we always spend time together. And you're not talking at a pace that I can understand. You're not looping me in on the conversation. You're not doing what I need because I haven't told you what I need because I don't want you to know. I can't spend time with you as much as I did anymore because I'm intimidated that you'll find out that something is wrong. Does that make sense? Mm-hmm. Okay, so we see a lot of folks being very nervous to participate in things, to be scared, to feel inferior. I think there's a big stigma with Alzheimer's still, with dementia still, that when I say, oh, I have Alzheimer's, people are gonna immediately treat me like I'm a 5-year-old. Not true, but that is how people think it happens. So when we're living with this and we're trying to kind of hide away from that stigma and to protect ourselves, we see a lot of withdrawal from work and social activities because of all of those things up there. So then because of 1 through 9, this is going to be our biggest sign, number 10. Even before memory loss is going to be changes in mood and personality. If I don't want you to know that something is wrong with me, and I'm trying to hide it, and I'm constantly living in a state of anxiety because I can't remember what I was doing or what the purpose of this was, and you're talking to me, and I'm trying to talk to you, but it's not really clicking in my head what I was supposed to say, and I'm 5 steps behind in the conversation, I'm frustrated. I'm frustrated. If I can't remember what task I was doing, I can't remember to get from point A to point C, I'm going to be frustrated. So people with dementia, especially in the early stages, are living at a level of frustration that's up here. Usually I'm like right here, right? I'm 1 honk away from sticking my head out the window and yelling at somebody. But if I'm up here, I'm not going to feel good, right? My change in personality is going to be sticking my head out the window immediately and yelling at someone. So when we think about changes in personality, if someone was always very soft-spoken, if they were always a very nice person, very relaxed, and all of a sudden they're saying words you've never heard them say before, that would be cause for concern for me. If they've always been a very social person and suddenly they're withdrawing, that's a sign of concern for me. So all of those things kind of wrap up with a nice, neat bow in making sense of where that's going to be our first sign. I know we think that memory loss is going to be the first one for us as friends and family, but really it's changes in mood and personality. Does that make sense to everybody? Okay, good. Good. Am I talking loud enough for everybody? Okay, I'm really trying, guys. I'm trying not to scream, but... So what do we do when we know that someone is living with some of these things? How do I have this conversation? How do I figure out how to help them or how to help myself? This is always the hardest part. So she says, did you look at the warning signs information I sent? I did, but I still don't know. Mom is showing a couple of signs, but not all the time. How do we know if it's serious enough to see a doctor? And she says, of course, let's check with our family friend doctor.
Memory is not all or none, especially when there are early symptoms or signs. So on a good day, people might function very well and not really even, no one notices there's a memory problem. But on other days, especially if they're tired, then things become more noticeable. So memory is variable. It's not all or none. And then there are different type of symptoms that develop for each person. So some people may have trouble with language, may have trouble with organizing themselves, may have trouble navigating while driving, and other people don't have the same symptoms. So you don't have to have every symptom of Alzheimer's to be concerned. And I think the most important thing is determining what has changed from that person's normal level of functioning. And usually people have a pretty keen sense of, what they can normally do well. And then when either they or the family notice that there has been some change from that usual pattern of functioning, that should be a warning sign to people. But they don't have to check up all the boxes.
So he said two things that I think are really important to take away. The first one is that no one experiences dementia the same way. Jill and I are very different. We have different brains, right? And we're both different than you. We've got different brains. We've lived different lives, different experiences. We have different health. All of these things play into it. So when you meet one person with dementia, it's not going to be cookie cutter for every single person, right? It's going to affect everyone very, very differently. So we do have to come at it from that very person-centered approach. If someone likes cats and I plunk a dog into their lap, I don't think they're going to like that very much, right? So it's even just knowing basic preferences that make our lives a lot easier as we work with people with dementia, as we're friends with them, loved ones, what have you. The other thing he said is that people have good days and bad days. Memory is not variable. And what he means by this is, does anyone wake up on the wrong side of the bed sometimes? Yeah? Has anyone ever had low blood sugar? Yeah? You feel kind of crappy when you do. You don't feel good when you wake up on the wrong side of the bed. You can have a bad day. The weather can be bad. We live in Western New York. Half of our life is snow. So there's all these factors that play into whether or not I'm feeling my 100% best. For me, I'm 100% best when it's sunny and 75. Great. But that doesn't happen quite often. So when we think about memory and attitude and behavior, all of these play part in it. Hormone imbalances, whether or not my medications are working correctly, if something is interacting, all of these things matter when I'm looking at memory and cognition. So the way that I want to go about it isn't so much, you have the signs and symptoms of Alzheimer's. It's more so, I want to make sure that everything is okay. Depression and anxiety are things that are manageable. Vitamin deficiencies, hormone imbalances, these things are treatable. There are so many things that it could be before I get to dementia that I really want to come at it from an angle of ruling those things out. Does that make sense? Okay, good. Because when I say Alzheimer's, it's scary. When I say dementia, it's scary. And I certainly don't want to come at it and say, Jill, there's something wrong with you. Right? I would never say that to her anyway because she's perfect. But we want to come at it from a point of helping someone rather than a point of saying, you did this wrong and I noticed, because that's not fair to that person and it's not a good way to have a conversation. And if you tell me that something's wrong with me, I'm going to get very defensive very quickly and we're not going to have a good conversation, much less a productive conversation. So why is it important for early detection? The most important thing that I can tell you with early detection, even though there is no cure for dementia, there is no cure for Alzheimer's specifically, is that the more I know, the earlier I know, the better I can plan, the better I can prepare. And it's 2024, there are actually medications that slow the progression of the disease, which has never happened before. I think it's 2024. It is. It's been a long day, you guys. But the point is, we're at a really pivotal point in research where the more I know, the more I can be involved, the more I can say, yes, I would like this new trial. Yes, I would like to be on this advisory board about how to talk to people with dementia. Yes, I would like to plan legally and financially and tell you what kind of care I would like, right? There's a way to do this with dignity and respect and with choice. So, does that make sense? Okay, good. Sometimes people are like, well, what's the point? Because it's all the same. And I'm like, but it's not all the same, right? Alzheimer's is super different than Lewy body. So I want to make sure that I'm planning correctly, that I'm talking to people correctly. So if we notice the changes in someone, we've got this fun little map. It's great. It breaks it down very easily. And the way that we want to talk to folks about it is, I want to assess the situation first. I don't want to come out swinging right out of the gate and say, this is what's wrong and this is how we fix it. Absolutely not. I want to start very slowly and see what we're thinking. Oh wait, what happened? Sorry guys, I gotta go back. There we go. There we go. So step number one, when step number one loads, making note of what we're working with, right? It's not just, hey, you've got a problem. It's, hey, I've noticed over the last 6 months, maybe you've been feeling a little down. Is there anything that I can do to help you? I've noticed you haven't been quite yourself. You've missed a couple of our lunch dates. What's going on? How do I do this? So what do you notice? I always tell people, write things down. It might not seem like a big deal when it's happening in the moment, but when you write it down and you kind of look at it all on paper, you say, oh, okay, maybe there is a problem. Or maybe you write it down and you say, there isn't a problem. But documentation is always going to be good. You can tell I'm a social worker. So what else is going on? Are there any stressors in someone's life? Have they had someone pass recently? Have they had a large health event? Is it 6 months of snow? What else is happening in their world that's causing them stress or concern or maybe just general feelings of blah? Step number 3 is going to be doing what you're doing, which is learn about the signs and the symptoms. What am I noticing? What is actually cause for concern versus what is not? And then, has anyone else noticed these changes? I love my sisters. We have a group chat, the 3 of us, and we talk about my parents all the time. We talk about how frustrating they are, and they, no, they're wonderful people. But if we were concerned about them, they've had a couple doctor's appointments recently, and that's where we say, okay, I'll pick up dad, you drop off mom, whatever. But if I had concerns, let's say about my mom, that's where I would ask my sisters, hey, have you guys noticed X, Y, and Z? If they have, okay, maybe I'm a little validated in what I'm seeing. If they haven't, maybe I give it a month and see if they notice anything as well. So finding people in your circle or that person's circle that you can trust, that you can bring these concerns to, again, before I go out and plunk it all in that person's lap. It's not meant to be malicious. It's not meant to talk about them behind their back. It's truly coming from a point of concern and care. So then have the conversation. How do I do this? How do I talk to this person? I kind of break it down for folks when they're in our office. And number 1, who should have the conversation to discuss these concerns, right? Does anyone have a favorite child? No? Oh, my parents do. It's me. Oh, okay. You guys are good.
Better than which one's with me.
There you go. Absolutely. So, some news comes better from other people. I love my youngest sister to pieces. We do not see eye to eye at all. So if she were to tell me something bad, I'd probably be like, Sarah, you've lost it. No, absolutely not. I'd write it off immediately. But if my middle sister comes to me and she's like, Claire, something is wrong with you. 1, I'll agree with her because she's a nurse practitioner. But 2, we get along better, right? So sometimes it's just about dynamics. It's relationships. It's saying, okay, maybe I should sit this one out and you should take the lead. How can I support you? So who should even have the conversation is a big one. What is the best time and place to have the conversation? Obviously, I think we should have a very serious conversation right now in front of all these people. So come on over, Jill. You gotta think about where we're having this. Are we comfortable in the apartment here? Is there a cozy cafe in town? Does someone want to go to their house? Do they have a favorite chair? All of this plays into it. I want this person to be comfortable while I'm talking to them. I don't want to feel like I'm, ambushing them. I don't want it to feel like an intervention. It's not. It's a conversation. But making sure that we're comfortable. Is anyone a night owl? I'm not. If you talk to me after about 8 p.m., I don't want to talk to you. Don't call me. Don't text me. I'm going to bed in about a half hour. But if you call me at 6:30 in the morning, I'm up and I'm ready. So my family knows it's probably better to catch me in the morning than it is in the evening because I'm winding down. So even time of day does play a part of it, believe it or not. So always take that into consideration. And then what will you say to the person that you're having a conversation with? I always encourage people to practice what they're going to say or write things down. Obviously you don't have to read a list of things that you've noticed, but summarize and say, hey, I've noticed X, Y, and Z. I'm really concerned. I just want to make sure that you're doing okay. Always use I statements. I'm worried about you sounds a lot better than something's wrong with you, right? Yeah.
Going crazy.
There you go. I would not suggest saying that to any woman. But practice what you're going to say, right? Offer to go to the doctor with that person. If that's something that, you guys have that relationship, you're comfortable going and being their support, oh my gosh, yeah, I'll take you to the doctor. We'll make sure it's not any of these things and you'll be good to go, right? Again, I'm not coming at it at a point from, this is Alzheimer's. I'm coming at it at a point from, how can I help you feel better, right? Can I rule any of these things out before we get to that point? If Rome wasn't built in a day, this conversation probably isn't going to happen perfectly right away. So sometimes break it up into little bits, let someone know that you're noticing some things, but you're here for them. Maybe the next time you have the conversation, I'd really love to help figure out what's going on. Can I take you to the doctor? Can we go together and then get lunch after? Something as easy as that can be hugely helpful. And people need time to process. If I give you a bunch of information all at once and then say, oh, okay, what are we ready to do about it? I need at least 24 hours, right? I need it to sit, to sink in, all these things. You gotta take time to make these decisions. That's important. You can't make decisions in the time it takes to brush your teeth. And then always reach out for support. And that is what we are here for at the Alzheimer's Association. So a lot of my job is sitting down with families or loved ones, neighbors, ex-spouses, it really doesn't matter, it can be anybody, and saying, how do I start the conversation with my loved one? How do I bring mom up to speed with what's going on with dad? How do I do all of these things in a respectful and dignified manner? So making sure that you have the support is exactly what we're here for. Turn to the Alzheimer's Association. We are in Buffalo, but I will come out here anytime. I love coming out here. It's a great drive. So if you even have like 3 questions, you can call. I will come out. We can go to Tim Hortons. I have funding from the state. Take this part out of the video. I'll buy you coffee on the state's dime, right? Please don't tell them that. It's okay. And then the last step, of course, is going to be to see a doctor, right? Find out what community supports are available, figure out how long it's going to take to get into the doctor, what tests they're going to do, and really let them know all of the concerns that we're noticing. No concern is too small. If the doctor has the best picture possible, they're going to make the best diagnosis possible. So we want to make sure that everyone is well informed. So when we think about seeing a doctor, the path that we're probably going to follow is primary care physician to specialist. So the specialist is probably going to be a geriatrician, most likely a neurologist, a neuropsychologist, a psychiatrist, or a psychologist. Probably a neurologist. I want you guys to have the MRI or whoever it is to have that actual imaging and figure out what's going on in the brain. So we'll kind of look at the diagnostic process next. It can be a long period of time. This is probably the most frustrating part of the journey, is actually getting the diagnosis. It can take about 2 years for us to see symptoms, get the initial referral, and then wait 6 months to get into the neurologist, wait 4 weeks for them to review, get a call back the next week. So that is really tough for folks, and I certainly understand that, which is another reason why I want to start this process as soon as I notice things are going wrong. Does anyone have questions? Okay, good, because I could just roll on and on and on and on. Please stop me.
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Also, the treatments that are available for Alzheimer's don't cure Alzheimer's. They don't slow down the disease, but they do help with symptoms. And it seems as though they tend to work better the earlier a person is able to use those. So that can help too. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
I really just think the most important thing is honoring people's wishes, right? I want to make sure that my loved one is safe, that they're having the care that they need, but also that we're doing this, and the key is always going to be a dignified manner, right? If I know so-and-so cannot live alone anymore, but they don't want to go into a nursing home, the most likely course of action is to bring in a home health aide, right? They can still enjoy their home, they can still enjoy the place that they prefer, and that's what they wanted. So some people are the opposite. Some people say, I would rather be with 24/7 care. Some people would rather live with a relative. Some people would rather do X, Y, and Z. I don't care because it's not my life, right? But I want to make sure that I'm honoring to the best of my ability somebody's wishes. Does that mean letting someone live alone for the entirety of the disease? No, absolutely not. Safety is always our bottom line. But when we're talking about, working with folks and really getting down to what they want, this is a long progression. So I want to make sure that from start to finish, that person is being honored as much as they can. And Alzheimer's or dementia of any kind is really not an immediate life changer, right? I walked into the neurologist's office, I walked out of the neurologist's office at the same stage that I was before. I think when we think about the diagnosis, we think that it's going to immediately change our lives, that it's immediate, that person can no longer hold a conversation how they could, that they're different because they have this label of the disease. And that's not true by any stretch of imagination. It's just not. They're still perfectly capable of doing many, many things on their own, of being social, of being, involved in doing whatever they want. So I want to make sure that I'm giving them all the tools to be able to do this independently for as long as possible, or for however long they want, right? It's up to them. So that's really the point of early detection, is to bring that person into the conversation. Because if I start talking about Jill like Jill's not there, do you know what she wants? I don't even know what she wants for lunch. Should we ask her? Oh, it's actually a good idea. Jill, what would you like for lunch today? You're gonna snack me if I talk to you like that, right? Mm-hmm. So making sure that I'm dignified. Jill, it's almost 2:30. What do you want for lunch today? You want chicken or turkey sandwich? Boom, she's probably gonna pick turkey. So the point is, I wanna make sure that I'm able to start these changes as quickly as possible. You guys have any questions about that? No? Okay. So seeking a diagnosis. This is where we're gonna get into that nitty-gritty of kind of how we start the whole process. And I've given you a pretty good structure of it. It's still not easy. If you have a good doctor, that makes a world of difference. So a little quiz for you guys. I've already given you this answer. True or false, there is currently no way to diagnose Alzheimer's disease. Thank you to all my false friends. There is a way to diagnose Alzheimer's disease. It's through that brain imaging, so that PET scan or the MRI. A lot of doctors will say, well, I can use context clues. And I say, why don't you just use an MRI? Because that's going to give me my 100% surefire answer. It's an image of the brain. It's not a guesstimation of the brain. So yes, there is a way to diagnose Alzheimer's disease. Likely, this is the course that we'll follow. So we'll see Mary's chart here. They've done a medical history assessment, a physical exam. They will likely screen for depression, and they'll probably interview one of her daughters to kind of see how Mary's doing. And then from there, at that appointment, they'll order some tests. So they'll likely do blood work just to make sure there's not a vitamin deficiency, that a hormone isn't imbalanced, that her blood sugars are good, you know, all the fun stuff that's in the blood work. But then they'll do that mental cognitive status test. Has everyone done one of those? Yes. I better hear a yes. Thank you. 2 hands. Excellent. So if your doctor is not doing one, let me call them. You should all be doing them. I think you're all fine. But what I would like to have is a sure answer that we are fine and that my baseline is being maintained as I age. So that cognitive test is going to tell me, okay, Claire, you're 28 years old and you constantly score a 28 out of 30. Fantastic. Where are you now scoring a 25? What's going on in your brain? That test is going to be my #1 thing that will tell the doctor there is something going on inside. I don't know what it is, but that will trigger my brain imaging, which will then give me, hopefully, a definitive answer. Does that make sense to everybody? It seems like an easy path. Realistically, this probably takes us about 15 months, which isn't great, but that's the system we've got, so. The mini cognitive tests are fun though, right? You panic about your middle name. You're like, oh, I think it's Taylor, but I don't know. I'm not sure. So I always get a little flustered, and I know everything's fine. It's just part of being at the doctor. So do dementia-like symptoms always result in a diagnosis of Alzheimer's or another dementia? I gave you guys this answer. I said the appointment has been going well. Mom is handling them okay. And do they think it's really dementia? I guess we won't know till we get a diagnosis, but let's ask the doctor if it could possibly be anything else.
Someone could have high blood pressure that's out of control, or they might have a thyroid condition that's not regulated, or diabetes that's not right, or on a medication that actually can cause memory loss. Drinking too much alcohol can make memory worse. So there are a lot of factors that go into cognitive difficulty with aging, that some of them can be remedied. And so we want to do everything we can to improve cognitive ability and quality of life.
So long story short, there's a lot of things that can go wrong with us. We know that, but does it always have to be Alzheimer's? No. I want to rule out all of those other things. I want to get the high blood pressure, the diabetes, everything else managed before I say, still cognitive decline, I wonder what that is. So when we're talking to folks, it's not so much an alarmist conversation as it is a conversation about overall health. Your brains, from what I can see, are all inside of your bodies. There's a lot going on in our bodies. So if one thing is out of whack, it makes sense that something else might be out of whack as a result, right? It's all connected, which is scary sometimes. But the point is, it doesn't always have to be a brain issue. Let's see, what else we got here? So when the diagnosis is Alzheimer's, what do I do? So how did it go? I'll call you later when I get home, but the diagnosis is early stage Alzheimer's. What do we do now? The doctor said the Alzheimer's Association offers free resources. We do. And some even help people live well with the disease. That's a big part of what our office does. They say we'll call soon, and then we'll call the Alzheimer's Association. So, if I had a nickel for every time someone said, I wish I'd known about you sooner, I would not have to work anymore. I'd be very rich, which would be great, except not a lot of people know to come to us right at the beginning of things. They don't know all of the things that we do that can help. So when we're talking to folks, I think the biggest push is to have people call us, even if you just have a question. Oh my gosh, call me. Has anyone heard of Prevagen? Probably a few of you. I'll do the research on Prevagen for you. I hate Prevagen. Don't cut that out of the video, I hate it. But the point is, even if you just have a general question about brain health, we're happy to be that first part. I am happy to do all the research for you. I got reading glasses this year. I'm ready to use them. So, it's great. The point is, let us help you. If you're concerned about something, if you wake up at 3 in the morning and you have a question, don't call me, but you can call our helpline, right? So we've got all kinds of resources for folks, and every single thing we do in Western New York is free. Because of that sign-in form, because of the grant that the state gives us, I'm able to come out here as much as I want. I'm able to do programs and give people resources and literally give them things that will help them because we're able to do this. So, even if you're just wondering, give us a call. It's a hokey little video. So the graphic is really meant to just show you that we are a national organization. There's not just one Alzheimer's Association in Western New York, but there is only one Alzheimer's Association of Western New York. We are very different than most other states. So because we're in New York, we are funded by the Department of Health. I'm able to offer a lot of things that we'll say our friends in South Dakota aren't able to offer because we're funded differently. Western New York is a very generous community, which we're very grateful for because we're able to offer things like driver evaluation services or medic alert safe return enrollments. We're able to offer animatronic pets to people for free. All of these things are free because we're funded very nicely through a lot of folks, which is wonderful. But it's tough because our friends in Pennsylvania aren't funded the same way. So I always tell people, call us first. If you think there's a service and we offer it, I will give it to you, right? Easy peasy. But we do have a 24/7 helpline. Our office is in Buffalo, but like I said, I will come out here. If there's an appointment at Dent, you can pop by our office later. We offer caregiver support groups, education programs like these. There's so much stuff, right? There's so much that we can do. We offer programs to help people who are living with early stage dementia. We're starting an early stage group with the Veterans Association at the VA, which is going to be great. So there's all types of things that we can do to help folks. We're one of the only chapters in the country who has a bereavement support group. I don't know if anyone has ever had anyone pass from Alzheimer's or dementia, but it's really hard. It's a different kind of grief. And we recognize that. We want to be there to support you even after your loved one is gone. So there's all types of things that we can do to help people, even just to talk it through. Really, sometimes you just need to sit down and have someone say, I think it's time to consider a different living situation. I like family care consultations. I've had 18 people around a table and I'm sitting at the front and I say, okay, we're all going to be on the same page. You don't have to like me. You never have to see me again, but you are going to listen to what I have to say and you are all going to leave on the same page. So sometimes even that's helpful to take that family dynamic and kind of put it aside and let someone tell you, you're full of it, you need to stop, right? This is what we're dealing with. So sometimes even that is helpful. And really, I did have 18 people around a table. It was horrible. It was a really long day. But the point is, we're really here to help however we can. Okay? If you guys have questions, I will be here after. But otherwise, thank you so much for having me here again and listening to me go on and on.